Okay, we're on to protocol number 7, trigger points. Boy, it seems like everyone's got trigger points as much as we sit at computers and over people all the time. I find trigger points everywhere, but especially up in the neck and the trapezius area, the levator. All these are really, really wonderful points that you can treat with the laser. Now, when I'm treating trigger points, I use predominantly red, usually for about 150 seconds, maybe to 180, okay? Once I feel the trigger point relax, then I'm done and I can move to another trigger point, okay? So when I come up here, and Sam will let us know here a little bit, I'm feeling some, definitely got some right there, it's a good spot, and then back into the shoulder areas and this particular area. But right here is a nice trigger point going on. So what we're gonna do, normally we come towards the skin here, but for demonstration we have the white so that you can see it. I have it set on number 7, which is trigger point. So I'm right over the trigger point. Hopefully you can see that. If I back it off, you can see probably through the camera what's going on. So what's a trigger point? It's really an area of the muscle that has really depleted its ATP and is causing a pain windup. So not only does a trigger point elicit pain here, but it can elicit pain to different areas of the body, right? So Janet Travell and her partner are really great in doing trigger point charts, and you can see, just like referral pain, that a trigger point here might cause headaches that are suboccipitable. It can cause pain to go to other directions. So not only does a trigger point cause pain here, it refers pain to other areas, right? So trigger points are really important to treat, really helpful, especially in the pain arena when you're treating musculoskeletal conditions. So I always like to come in here. This way I can have the laser here. I can be working with my hand or my finger over the trigger point. Some people use tools on it. And what I want to do is I want to get in there and just help manipulate and move this trigger point out a little bit further. So I'm in here with my thumb. I can feel it. It's moving around on me. So it's a pretty good one, wasn't it, Sam? Here?
Yes, sir. Yeah.
You can feel that one. Now, does it stay here, or is this one, does it go anywhere else, or does it stay pretty much where my thumb is?
Pretty much where you're at.
Okay, all right. Not all trigger points refer, but a lot of them do. Just take a look at any trigger point chart, and you'll see lots of times people are having pain in one area, and when you look back, you'll find it was different. So it might have been a pain or a headache here, and where was the source of the problem? It was right here on the trigger point. So usually about 2.5 minutes. Sometimes it goes really fast. Sometimes they're a little bit more stubborn, but really my protocol is about 2.5 minutes, usually predominantly red, and you can feel that. So you can just feel, I don't know if you can see my shoulder, you can just look at it, you can feel that relax out.
Yes.
You can just feel it unwind. So even though I'm lasering here, I'm also getting a systemic effect, and these two actually correlated. All right, so that was trigger points.